My name is Mindy.TV. I'm a certified transformational nutrition coach and yoga teacher, and I'm here with the amazing Dr. Kevin Weiss. He is a doctor of osteopathic medicine, and he's at the Morrison Center here in New York City. Also, side note, he's my personal doctor, so I absolutely recommend him. And you have been here for a little while now with Dr. Morrison at
Correct.
The Morrison Center.
I mean, I was trained in family practice,
Mm-hmm.
so we kind of see the gamut of things. So absolutely, sports injuries, musculoskeletal pain, digestive issues, chronic infections, chronic fatigue, and we also tend to even see a lot of what people call as mystery diseases. We do a lot of functional medicine here at the Morrison Center, and oftentimes what we're able to help people with is to take, we're called holistic doctors because people often come to us with a whole list of symptoms.
Yeah.
And oftentimes what we're able to do for people that they may not be able to get in other places is to be able to connect the dots with symptoms that otherwise would have seemed unrelated. And often with people that have gone from doctor to doctor, and be able to help them put it together, make sense of it, and help them get better.
Yeah, you definitely helped me connect all the dots and uncover a lot of other things that were going on that I didn't realize, even though I had been to other doctors in the past. So yeah, I can definitely attest to that. A lot of people are familiar with like MD and family physician. So can you explain what doctor of osteopathic medicine means?
Yeah, absolutely. So there's two kinds of licensed physicians in the United States. There's MDs, which we're all familiar with, and then there's also another kind of physician called a doctor of osteopathic medicine. So the training, in many ways is very similar. Both MDs and DOs, which means Doctor of Osteopathic Medicine, they both go to medical school for 4 years, and then they both go through a residency program to go into a specialty of their choice. So for me, I have two board certifications. One is in family medicine, and the other one's in neuromusculoskeletal medicine. So there are DOs out there that are neurosurgeons, that are obstetricians, and would practice medicine the way you would expect from any other MD physician. In the osteopathic medical school, there's a little bit more emphasis on holistic medicine and mind-body-spirit connection. And then there's also additional training in diagnosis and treatment of the musculoskeletal system. So the doctors are actually taught to work manually with the human body to help adjust the musculoskeletal system to improve health.
Yeah, that makes total sense. Thanks for explaining that, because like you said, a lot of people aren't familiar with that, so now you can understand it's more of a combination of everything, and specifically in the way that I describe it is more of like getting to the root of things, like uncovering everything.
Absolutely.
Yeah.
Yep.
So then also, what would you say is your most miraculous patient story?
Can I talk about a couple of them?
Yeah.
Okay. All right. So there's a couple. So there's a lot of different things that I do. So I'll give you a couple of different examples to kind of give an idea of the gamut that we'll do here at the Morrison Center. So the first patient that comes to mind is a young gentleman that was around my age that came to see me, and his initial presenting complaint was that he was having chest pain and he was short of breath. So by the time he got in to see me, he'd already seen a cardiologist, and he ended up seeing a pulmonologist, and neither of them could find anything that was wrong with him. They ruled out asthma, they ruled out any other, of the typical diseases that they would see that would explain those symptoms. So the first time that I saw him, he came into the office. So because of my osteopathic training, I knew that I should, take a look at his musculoskeletal system and assess it from that standpoint, because sometimes muscle spasms and such can cause such symptoms. So when I put my hands on him, it was crystal clear that, he had obvious musculoskeletal dysfunction. So we did, maybe 10 or 15 minutes of manipulation with him, and he got off the table and he looks at me and he says, "I feel like an elephant came off my chest."
Oh my gosh.
So I said, "Okay, great. Why don't you come on in and see me next week, and we'll do a little more." So he comes back in. He's feeling a lot better, but he's not all the way over the hump yet. He's still feeling a little bit winded when he's walking around the block. He's still having the chest pain a little bit. And so I dug a little bit deeper in my physical exam, and I kind of ran my hand down his spine, and the area of kind of in the mid back that's associated with the nerves for the gut had a lot of tissue texture changes, meaning that it felt boggy, it felt moist. It felt kind of ropey. So there was dysfunction going on in this area.
Yeah.
And so, they train you in osteopathic medical school to be able to recognize these connections. So I asked him, okay, well, we know there's not much going on in your heart or your lungs. What's going on in your gut? And he tells me, I've had the most god-awful diarrhea and abdominal bloating for the last 5 years. So I said, okay. And it sounded to me based on his symptoms, that he had a condition called small intestinal bacterial overgrowth.
Mm-hmm.
And so we did the test for that, and we gave him some herbs to treat it, because sometimes it will respond to herbs.
Mm-hmm.
And he came back in afterwards, after the test was done, and he was doing better. He stopped having diarrhea, and his chest pain and shortness of breath was a little bit better, but he was still bloating, and the symptoms weren't quite gone. So the test for this condition of overgrowing bacteria came back off the charts. I mean, it was sky high. And I generally like to avoid giving drugs, but at this point he really needed one.
Yeah.
So we gave him an antibiotic that was actually not absorbed into the bloodstream. It just works in the gut, and then he can just poop the rest of it out.
Mm-hmm.
And between that and doing a number of supplements to also heal the gut that had been inflamed for so long, and also staying off of gluten was a big thing for him. We had him as part of the diet. He got off gluten, and he saw that when he reintroduced it back into his diet, he predictably would get chest pain and short of breath.
Wow.
So
that's pretty strong.
Pretty strong, yeah. So that case, I think, does a nice job of explaining, kind of how we put this myriad of symptoms together that otherwise would seem unrelated. But certainly when somebody has inflammation in the gastrointestinal tract, it can get into the rest of the body and give you a number of symptoms that would seem unrelated, but in fact they are.
Yeah, that's amazing. So, this 30-something-year-old man comes in with chest pains. You do some adjustments in the back, and you find some distress in the gut. So by healing the gut with the supplements and the herbs and the antibiotics, that connection was healed, and so he no longer had the chest pains and the back pain.
Essentially what happened was that the nerves that control the gut basically referred to the same point in his back where he was having a lot of the symptoms. That's kind of what touched it on. Everything is connected. You've got it. That's it.
Also, another thing I'm sure a lot of people haven't heard of is SIBO. Can you the small intestinal bacterial growth? How do they get that?
The most common reason that people end up getting small intestinal bacterial overgrowth is because they have not enough stomach acid. So this is very rampant in society. A lot of people are on these proton pump inhibitors, these purple pills that get advertised on television. And, and sometimes, for a short course, people do need them for certain, disease processes. But really they were designed for people to be on them for maybe a month at most.
Right.
And we know that long term, people that are on these things for, quite some time are more predisposed to osteoporosis, predisposed to not absorbing their minerals, their vitamins. They're more likely to get gastrointestinal infections, and even the risk of gastric cancer is slightly increased when they take these medicines for a long time.
That's crazy.
Yep.
And these things are now over the counter.
Correct.
So people think, oh, I have acid,
safe,
I
right?
have reflux, I'm just going to keep taking it, not realizing that they could be doing damage.
Right, exactly. And so what happens with SIBO is when you don't have enough, the stomach acid actually controls what bacteria grow or don't grow inside of your gut. And so when there's not enough stomach acid, what can happen is some of the bacteria from the large intestine can reflux into the small intestine, and they tend to ferment what's called hydrogen and methane gas. And so that's, the people that complain of these symptoms of, Doc, I really bloat a lot, 2 hours after I eat a meal. And the people that also belch a lot, it's because that they have these organisms in them that are fermenting the gas. And what can happen is with the acid, even though their acid is decreased, the gas can come up their stomach, take the little bit of acid that they are making, burn their esophagus, and then they take these acid blocking pills, and it makes the whole problem even worse. Yeah.
It's painful and annoying, and so, it's good that you obviously knew that and put two and two together.
Yeah.
And then also by taking the gluten away to help him solve that issue.
Yeah.
That's amazing.
Yeah, this guy, much to his chagrin, he has to be very careful. Even having a little bit of beer, which is made with wheat, is enough to touch him off. And he doesn't have celiac disease.
He does not have celiac.
No, this is a very important point, is that just because somebody doesn't have celiac disease, they can certainly be gluten sensitive. This gentleman didn't even have the genetics. He did not have the genetic predisposition to even get celiac disease, but yet he was still that sensitive to it.
Wow.
Yep.
What do you think it caused that for him to be sensitive to it, even though he didn't have the markers?
The science is still unclear about. From my standpoint right now, I mean, we could make all sorts of, there's all sorts of theories out there. Some people think that so many people are sensitive to wheat because at least in the Western Hemisphere, they've been crossbred to produce more gluten than it was a couple thousand years ago. That's one thing. And then, there's also the whole issue of GMO and then the glyphosate and all these things. So it's... I can't give you, and it may be different for different people. It's hard to say, but regardless, for this gentleman, when he ate wheat, he got symptomatic, so he needs to be off of it.
Yeah.
Yeah.
Okay. That's a great patient story.
Yeah.
And you had a couple more.
Yeah. Oh, another really nice case that we had was another younger lady that came in that had a quite traumatic childhood. And her history was that she was rowing a boat at summer camp when she was about 13 or 14 years old, and just the simple act of rowing threw something out in her back, and she came in to me 20 years later saying that I've been in 10 out of 10 pain for my life ever since that happened. And she'd been everywhere. She'd been everywhere. And so we did a number of things with her. We did a bunch of osteopathic manipulation, kind of like we did on that other gentleman, but of course we custom tailored it to her particular body. And we also did a number of injections, kind of just superficially in her skin to help calm the nerves down. And that gave her a lot of relief. But I think maybe for her, one of the biggest things that we did was that we actually did a little bit of, we did a lot of emotional work with her. And so there's this idea of, you may have heard of cellular memory. So, I can't point to, a study in the medical literature that will prove this, but, the experience from me and from, osteopathic physicians over the last 100 years or more is that whether, an injury that we take on, whether on the physical level or on the emotional level, and our systems aren't able to cope with it, it can get stuck in the body. And so when people go through traumatic emotional situations, I would submit to you that it gets stuck in the body. So there were certain parts of her that she was hanging on to, hatred towards a mother or frustration with a brother, all sorts of different things. So the skill from my side is, just having done this for nearly a decade now, it's just a matter of experience. You put your hands on enough people and you kind of get a sense of what emotions can be stuck where in somebody's body. So I was able to detect, where she got stuck in her body, but, she really did her work in the sense of she took her attention to that part of her body where she was feeling the tension, and she went through the emotions and the sensations that she was experiencing there, and she got herself probably in about 10 or 12 visits from having 10 out of 10 pain every day of her life to maybe, having 0 to 1 out of 10 pain every day and needing to see me maybe every 1 or 2 months to get a tune-up. So, I mean, for me, the goal is always to be able to get somebody, where they can live their life independently. So from my standpoint, I'm a little bit of a perfectionist, and I would prefer that she wouldn't have to come see me at all, but it's a lot better than it had been in the past for her.
Yeah, I mean, years of having 10 out of 10 pain in your body and just not being able to physically do things. I mean, that severely inhibits living.
Yeah, absolutely.
So by coming in and dealing with her past emotional trauma, and doing the breath work, processing those emotions, that helped to open up those soft tissues that had been storing those past traumas.
Correct.
And so, so she came in with back pain, obviously, but before she did that, did she put 2 and 2 together that maybe the emotional stuff was causing the physical pain?
Yes, she had a good deal of awareness. In fact, I remember one of the first things that she said to me was that this is my mother stabbing me in the back.
Oh my goodness,
So
just gave me goosebumps.
Yeah, she knew on some level.
Yeah.
She knew, and she needed a little bit of help processing it, and that's kind of where we came in and helped her out. But it really demonstrates the point that someone that's really she really took ownership of her own stuff, so to speak, and when people do that, then it really kind of opens up the heavens, so to speak, in terms of what's possible with healing. So my experience has been, and my mentors' experience has been, that when somebody is ready, willing, and able to heal, and they're taking responsibility for what's shown up in their life and for what continues to show up in their life, then these are the people that tend to really do well. It's the people that tend to be stuck in blame and victim consciousness that tend to have trouble healing.
That makes so much sense. You're absolutely speaking my language.
Yeah, and not to put down, certainly, I'm just as guilty. I've also been stuck in blame and victim consciousness in certain aspects of my life. But we take responsibility for it and we move through it.
Yeah, and I think it's also like it's having the time, like you play the victim for a while, get stuck in that, deal with it, and then you just reach a point where you get sick of it. And it's like, okay, no more. Like, I have to do this and work through this, and you want to help yourself. And
change is stressful. Even if somebody's trying to break a bad habit, change is still stressful.
Right.
So some people just need a gentle tap on the shoulder to do it, and some people need a big wallop.
Yeah. So it's amazing that they're healers like you, super intelligent and caring individuals like you to help work through all of those issues. Because, we've done a lot of work, with my past issues, emotionally, physically, nutritionally, like everything.
Yeah.
All of those mystery things and putting all the pieces together. And, I did a lot of work before I came to you, but then did even more work when I came to you.
Yeah, and absolutely, and kind of how I told you from the get-go, for the purpose of the viewers, we had talked from the very beginning, the first time that Mindy and I worked together, her whole system was super responsive, and I think I even asked you, like, what kind of work you'd been doing, because everything just fell out so easily.
Yeah.
And so, I mean, it's always a treat for me to work with people that are taking responsibility for what's showing up in their lives, doing their work on themselves, and it just makes the healing process so much easier.
Yeah.
It's fun for me. It's fun for the patient. They feel better, and that's why I show up for work. That's why I do this.
Yeah. That's amazing. And I would say, like, even though I did all of that work, it was like the work that I did with you, the emotional stuff, that was almost like the missing piece of the puzzle.
Yeah.
And like once I put that into place, like I just started healing, like a next level. It was amazing. So thank you.
Yeah. Do you maybe want to talk a little bit more about what that experience was like for you?
Yeah, I would describe doing some of the emotional work with you. I would say, like, before I did the emotional work, I came in, I had a lot of physical pain. I definitely had chest pain. And like you said, I had been to a cardiologist before that, did all of the tests. I thought there was something wrong with my heart. But, you did the thing where you run your fingers down my back and you could feel where my body was storing that tension and those emotional traumas. And I had some idea, but I wasn't, aware of all of it. I thought that I had, dealt with that before and some of the work that I'd done on my own. But, once you helped me locate those areas, and I would do the breathing and it would just release. And it was like almost this, I don't know, almost like this weight, this emotional weight was lifted off of me. And after my first treatment of doing the emotional work with you, I just left your office and I was like floating around the city. I was like, this is amazing. I have no pain, no cares in the world. I'm just gonna a walk through Central Park, and it doesn't matter what happens.
Awesome.
It was amazing.
Awesome. Yeah, and I think it really set you up to heal, even like from the physiologic standpoint, because I know having you'd worked for orthomolecular, and I mean even though you're not like a licensed healthcare practitioner in terms of being a doctor or a nurse or something, I mean your knowledge of functional medicine is fantastic. And you would in terms of supplementation and lifestyle and diet, I mean you had been doing your due diligence for a long time before you ever stepped foot in my office. But once you've done that emotional work, I feel like the little bit of supplementation that we did, and the little bit of vitamin IVs and mineral IVs that we did, were able to kind of take you to the next level. Whereas probably before the emotional work, it probably wouldn't have been as efficacious. I mean, I can't say for sure because I wasn't treating you at that point.
Yeah, I mean, a lot of healing happened in a very short amount of time.
Yeah.
So, big difference.
Awesome.
Yeah. Thank you. For your top 3 tips, anything that you do personally or that you recommend for a lot of your patients?
So tip number 1, we touched on this earlier in the conversation, but take total responsibility for everything that shows up in your life, everything, because my strong feeling is that when we really take ownership of what's showing up in our life, so whether in spiritual, mental, emotional, physical, biochemical ways, that it basically we're qualifying ourselves to heal from what's been holding us back. If we're stuck in blame or victim consciousness, again, I've been there, and sometimes I fall back here and there. It's okay. It's part of being human. But if we can train our minds to be in that space of taking responsibility, it really kind of opens up the door in terms of what's possible in healing ourselves.
Absolutely. I agree with that. I was stuck in victim mode for a while, and enough was enough, and victory is my mantra now. So it's responsibility and acceptance for yourself and your health.
Yeah, absolutely. I mean, in some sense, it doesn't matter, whether you're born with a silver spoon in your mouth, life is still to some degree inherently traumatic for everybody. But the nice thing about the work that we do in the office here, and in tandem with taking responsibility for oneself, then you're not relegated to carrying it with you for your whole life. Then you can as you experience, you can just drop that baggage and move on with your life.
Yes.
Yeah.
Drop the baggage. Love it.
Connect with a higher power. That's tip number 2. So that might look different for everybody. I'm certainly not going to sit here and tell anybody how that should look for them. But my experience and even the medical studies out there, that the people that do connect with a higher power, that are into prayer, that are into meditation, overall, we won't get into like specific studies right now, but let's suffice it to say that overall they tend to do better. And a very simple explanation of that would be that as you connect with a higher power, it allows one to have faith that things will work out, to have faith that things can change in a positive direction. And as that happens, our nervous systems tend to calm down, or our sympathetic or fight or flight response calms down, and that enables us to heal a lot more easily.
Yeah. I'm all about it. Prayer and meditation, believing that I'm not the only one out there. There's something bigger than me, and so connecting into that, it helps us feel like we're not alone too.
Absolutely. Okay.
Number 3.
Tip number 3. So the last thing that I recommend doing is reducing toxicity of all forms. So oftentimes, when you think about toxicity, some of the first things, at least that will come to my mind, will be, eating organic, because, as things that are not organic, as we know, there are pesticides, there are hormones, there are fungicides, some of these things that are even coming out in the news to be shown to be carcinogenic or cancer causing. So that's a big one. Feed your body with good high quality octane fuel with a good solid organic diet. I mean, there is the clean 15 and the dirty dozen. So some things you can get away with doing non-organic, and I'll even do that myself sometimes. You don't need to be perfect about it, but the more that you can do that, then the more benefit that you're going to get. Making sure that we're breathing clean air, spending time in nature, but also not accepting toxicity that comes up in our own minds, self-doubt, negativity, blame, or also accepting toxicity from other people. And sometimes this can be very difficult because we may have a loved one or a friend or a coworker. And so, I'm not saying, leave your leave your spouse if they happen to be, having a negative bout, or walk out of your job because your boss happens to be negative for a couple of days. You have to use your judgment to navigate these situations.
Right.
But at least inwardly, to not take somebody else's toxicity and hold it in your heart. And one of the ways that you'll know that you're doing this is if you're blaming this person, thinking negatively about this person, just let it wash off of you. Just let it wash off of you.
Yeah.
Yep.
I don't want extra baggage, so
yeah.
There's no reason to carry around somebody else's baggage.
Yeah, most of us have enough of our own.
That's exhausting. So awesome. Great stuff.
Great.
Yeah, so thank you so very much for your time
My
and
pleasure.
for all of your amazing information. So if you are in the New York City area and you would love to find out more about how you can work with Dr. Weiss, I have the link in the show notes so you can find him at the Morrison Center here in New York City. So thanks for watching, and we'll see you next time.
All right, look forward to seeing you soon. Take care.
Thanks. Bye.
Bye.